This is an Israeli bandage or emergency bandage. It comes vacuum sealed in a package like this. There's actually two packages. You rip this one open and then inside you'll find another package covering the Band-Aid. The reason for that is that this is sterile, so the pad inside it is sterile. The pad goes directly over the wound as shown in the next video.
Majority of the patients you're going to be taking care of actually will probably not need a tourniquet. Most of the wounds that we see and trauma patients or accidents can be resolved just with direct pressure. But to keep from you having to hold direct pressure on a wound all the time, you can actually use the Israeli bandage. When this is applied correctly, it holds about 30 to 40 pounds of pressure alone without you having to hold your hand in place. So it works really well. With the Israeli bandage, everyone should have taken one out of a clean package. You'll notice it comes just like this once you take it out. So step one, where you see the pad, put this directly over the wound, and you notice this plastic piece would be right in that same spot. Again, if it's right above the knee, I'm going to start like this. I will take the bandage, wrap it around, hook it through, and then I'm going to bring it back. So now this should be over the wound, and you're going to continue to tightly wrap.
Okay.
As you're doing this on your partner, you're going to notice that it gets firmer and firmer and more difficult to have sensation in your foot as you go. Just means that it's working. So they should be complaining of some numbness, some tingling, even some loss of sensation, because that's how much pressure this bandage alone is able to hold. When you get to the end, these small hooks here can go around the ace part of the bandage and hold in place. So go ahead and practice that on each other. Do actually try to get it as tight as you can go.
So the Jim Fennell version, I'm gonna use your leg.
Yeah, go ahead.
Okay. You start the same way. He looked at doing this to try to prevent sliding and also to try to help seal in a wound in terms of keeping it cleaner, because how often do you have a nice pristine sterile site that you guys go to? What, never. So instead of going directly in this the first time, go a leap around the top. And the thighs might be a little bit harder. The arms are a little easier on this, but you do those, and then you can go through your, so now it's not going to slide up or down. You see linear edges, and now you can crank down. We've had some of this, if you crank down the first time, it'll pull itself around, and you can't get a really good tight seal there. So that's just another option. And then you finish it the same way you were before.